Well, good morning, everyone, and thank you for joining us to discuss the Medicare Preventive Services tool. My name is Karen Curtis, and I am a Provider Outreach and Education Specialist here at WPS. Today, I am joined by my good friend, Aline Sigler. Aline will be monitoring the chat for questions, as well as providing you with some additional information and links. Now, last month, I held a webinar on CMS resources where I mentioned the Medicare Preventive Services tool, but today I want to take a closer look and I want to spend a little bit more time showing you this tool and what information is available. And just a couple of housekeeping things to cover before we get started. First, if you haven't downloaded a copy of the presentation and you would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center, along with a list of our upcoming events. Aline will also add a link in the chat so that it will get you there quickly. Now, our training center also contains a web page for our encore presentations, and videos are available for up to 90 days, and they can be watched on our web page without you having to go to YouTube. We know that some of you may not be able to access YouTube from your company computer, and we want you to be able to receive the education that you're interested in. Each encore is posted with a link that will allow you to download a copy of the presentation. You will also be given another chance to complete a survey and provide your feedback. Today's presentation is being recorded, and if there's no technical issues, it will be posted out to our website within a week. Later, there will be a question and answer session if time permits. If you have questions related to today's topic, please send those using the chat feature. If there are any questions that I don't get to, or if some require additional research, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with excellent customer service. We want to know how we're doing, so later in the presentation, you'll be given the opportunity to fill out a survey. This is your chance to let us know what we're doing right, and let us know if you feel that there's areas where we can improve. It also allows you to give input on what types of education you would like to see in the future. Now, while this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you ask for. This is a copy of our disclaimer. I will let you know if you have any questions related to specific claims, those would need to be asked to our customer service staff, as they have access to the system and they can help you based on how your claim processed. CMS does prohibit recording of this webinar for profit-making purposes, and we are recording this event and it will be available on our website and YouTube channel as an encore presentation. Today, we're going to look at the Medicare Preventive Services tool. I hold a monthly webinar covering the different preventive services that Medicare covers, and I found that this tool is really helpful. I'm going to start out by telling you how to navigate to the tool, and then we'll go out there and I'll show you what's available. So first, you're going to want to start out by going to the CMS website at cms.gov. And from there, you're going to click on Medicare, then Coverage, then Preventive Services. This is going to take you to the Medicare Preventive Services webpage. Now, you can see by this screenshot that there are quite a few topics out there, and if you click on those arrows, then it will drop down and it will have links to additional information. If you scroll all the way down to the bottom of the list, you'll find resources. So if you click on that, then you'll find the link to the Medicare Preventive Services education tool. Now, here's a list of the information that you can find on an individual service. If there is an NCD related to the service, then you're going to find a link underneath the title. CPTs and HCPCS with their descriptions will be listed along with the information as to whether that code can be billed as a prolonged service. Now, prolonged services are when the physician spends additional time with the beneficiary, and it's considered to be rare and unusual when that happens. You can also find covered diagnosis codes and telehealth eligibility, coverage and frequency requirements, and patient cost sharing. So now I'd like to take you out there. We're just going to go ahead and Aline, can you see the Medicare Preventive Services tool?
Yes, you're in the right place. Thank you.
Okay, great. Okay, so first I'm just going to start out here with the overview. If you click on that, it just kind of tells you the information I had already given, what's available. It does say that content changes are in dark red. Down here, it does give you a little bit information about requesting Medicare's patient eligibility status and gives you a couple links for that additional information on that. If I move over, we have the telehealth eligible services. If I click on that, you can see there's a list of telehealth services. There's different links for resources. Now, this third one is actually a Medicare Learning Network telehealth service fact sheet. I personally like when the Medicare Learning Network puts out fact sheets and bullets because I find that the way they present the information is easy to understand, and I think the flow is a little bit more user-friendly than sometimes looking at CRs or looking at the manual. So this is out there for the telehealth portion. Get out of these. Here, the FAQs tab, if we click on that, it has information on checking eligibility. There is for providers, if they have problems with their patients following up on routine preventive care, there is a link to a preventive services checklist. And this is something that I have shown in other webinars. It's something that can be printed out and given to beneficiaries, and that way they can kind of check things off as they get them. So that could be helpful to some of you. Here is some information about Medicare Preventive Services. I'm not sure if everyone's aware that the U.S. Preventive Services Task Force, they kind of they review all of the preventive services and they score those with a letter grade. And ones that are scored with a grade of an A or a B, then Medicare offers those without cost sharing for the beneficiary. There's also some information about if you wonder how a new preventive services could be added for coverage. So that's kind of what this section is about over here. It also gives you a definition of what a primary care setting is. If I go back up, the resources tab gives you a link for the CMS Preventive Services for their actual web page. So this is the screenshot I had showed you earlier, where it gives you links and you can find information, additional information on preventive services offered. The other link is not working, so I'm not quite sure when that'll get fixed. Down here, I wanted to bring to your attention, they have advanced health equity. Now, this is something CMS has been working on promoting health equity. And so they did add this more recently where you can have some links over here on this CMS Office of Minority Health. the Health Equity Technical Assistance Program, disparities impact statement. So just some more information if you're interested in the health equity. So now I want to start going into the actual services and kind of showing you what's available. I had a couple written down that I thought had some good information just so I could kind of show you all the different things. If we go into the annual wellness visit, you can see it tells you right here that it is telehealth eligible. It lists the HCPC and CPT codes that would be billed for these services. Now, this particular does not require a specific diagnosis code, but you'll see in other ones, they would be listed here. It tells you for eligibility that it covers patients who aren't within the first 12 months of their Medicare Part B coverage, and also haven't had an initial preventive physical exam within the past 12 months. It lists frequencies, and here you can see it's broken into the codes. If we scroll down, it also gives patient pays information. And this was one where there was a lot of additional notes with links. This is the advanced care planning. This was added recently to the annual wellness visit, so you can see they have a whole fact sheet on that where you can get more information. It talks about deductible and co-insurance when this service is delivered outside of the annual wellness visit. Here's another one of the MLN's educational tools. So this is just on the annual wellness visit and the initial preventative physical examination. This is also a great resource if you want more information on those two services. I'm going to go here to select another service. The colorectal cancer screening, this is one where an NCD is associated with it. So you can see here it gives you the link, and that'll take you directly to the Medicare coverage database, and you can look up the NCD that is associated with that service. This one also has a link for the diagnosis codes. And when we go down to frequency, it's as you can see, it's a little bit more detailed. So I thought that was another good one just to give you options of what information that this tool can provide you. If I go, sorry, taking me just a second here for the flu shot and administration. Here you can see there's a little box here and it tells you what's changed. So this tells you it's been updated with the 2024-2025 flu season vaccine codes. And you can see that all those new codes have been added in red. So that way it kind of jumps out at you. You know exactly what's new. This does have the specific ICD-10 code that you should be using. Again, other notes, there's a lot of additional information with links that you could look into. There was one service. This is brand new. So this tells you that it was added coverage effective September 30th. So I thought that was great. It even gives you the effective date. But as you can see, this whole thing's in red because it's brand new. Now, one thing I have noticed while I'm going through these and looking up some of the services, the Medicare Preventive Service, this tool seems to get updated quicker than the manuals. So if you're somebody who maybe looks at the Medicare Claims Processing Manual and maybe you use that for guidance. There are times, like I've noticed recently, and I'll show you here, with the lung cancer. If I click on lung cancer screening. So if I'm looking here at the Medicare Preventive Services tool, it lists the HCPC codes G0296 and 71271. But if you're in the Preventive Services manual, let me find that real quick. So if I went to the Preventive Services manual and I looked up lung cancer screening and I start looking at, okay, how am I supposed to bill this? It lists 2 G codes. So it doesn't until you get down here as you continue to read, and I'm sorry if the scrolling bothers you. It doesn't tell you till down here that in December 31st of 2020, HCPC code G0297 is indated and replaced with the 71271. So it kind of takes some digging to go through the manual to find out that that code's been replaced, where if you use the Preventive Services tool, it's right there to show you that. There has been a couple other things that I have noticed that in where there's been outdated information in the manual, but this tool has been up to date and has showed the most recent coding. Here again, it takes you to the NCDs. This has some other notes. There's also some of these services where if a modifier is required, down here in the other notes, it will list what modifier should be billed and what circumstances it should be billed in. So overall, I just find it a really useful tool, and I wanted to show you guys this today so that hopefully that can help you when you're trying to bill preventive services. I'm going to ask Aline before I go back, has anything been put in the chat? Are there any questions that anybody has on this?
Thanks for that great information. This is one of the best CMS tools, in my opinion. In scrolling through, I do not see any questions at this time. If you do have a question, drop it in the chat.
Okay, thank you for checking on that. I'm going to go back to the presentation here. Now, I don't know if all of you have heard, but CMS has issued CR 13754, which has directed MACs to disable the eligibility portion of their interactive voice response systems, or IVR. And this is being done to help protect beneficiaries from Medicare fraud. CMS is really taking steps to make sure that only people who should be getting beneficiaries' personal information are getting it. Now, this is, at this point in time, this is a pilot, so we will wait for CMS to make a final determination as to whether or not the option will be entirely removed. There are other options available for obtaining eligibility, and this would include the secure portal, which we will be holding some webinars on that, and also direct data entry for DDE users. And that is for providers who use the FIS system. And then, of course, there's also the HIPAA eligibility transaction system known as HETS. We have had a few webinars in the past, but starting next month, we're going to be offering them a little more frequently. Hopefully that'll give everybody a chance who wants to get information on the portal and on the DDE, how to do that, how to access eligibility. It'll give everybody some chances to attend these webinars and get the information before that function is removed. Now, I will check in real quick with Aline just to see if anything has come through while I was going through that IVR.
There are no questions at this time.
Okay, thank you. Now, after the close of today's webinar, you're going to receive a thank you for attending email, and here is where you're going to find your proof of attendance and contract hours for continuing education units. The email also contains a link which will give you another opportunity to provide feedback, so you can see that at the top, and then down further in the email will be your certificate of achievement. Now, if you don't get this email, you'll want to check your spam or junk folder, and you'll also need to add the messenger@webex.com to your safe sender list. That should allow you to get these anytime in the future, and that way you don't have to go searching for them. Now, if somebody happened to join by phone only, you're not going to receive this email. And in those cases, you're going to have to send an email to the education mailbox with your name and the phone number you used to join. And that way we can email a certificate to you. Now, I know there may be things like once you go out there and start looking, you might have questions. So something may come up after this webinar ends. If you do think of anything, you do have 7 days to send those in, and you can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line, and that way whoever is monitoring the mailbox knows that your question is related to this webinar, and they'll send that directly to me. Once again, if it is claim specific, then you would want to go to customer service. When you disconnect from the webinar, you will be redirected to a CMS survey. I am also having Aline add that link in the chat. So your feedback really does mean a lot to us, and we review what you have to say, and we do our best to make the changes that you ask for. This is also an opportunity for you to let us know what topics you would like us to provide education on in the future. So please be specific. Sometimes if we get like rural health clinic, we don't know if it's just general or if there's specific things about billing rural health clinics that you want to know more about. So being specific helps us out a little so that we can kind of tailor that education to what you're looking for. Also, if you have ideas that you think would improve how you receive our education, be sure to tell us that too. That's something that we want to hear and want to do better and want to do what you're looking for. Now, the redirect tool looks like what you see over here on the bottom right. And we don't have control over the way it looks, so we just want to make sure that you know it's nothing malicious, it's not spam, it is the CMS survey. Well, that brings us to the end of today's presentation. On behalf of myself, Aline, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.